and welcome to Senior Circuit. We're so glad you could join us today. We're talking about the wonderful open enrollment for Medicare. It's always so much fun, and we love it. So, and with me today are my two very qualified, very capable social workers from the Council on Aging, Natasha Naim and Ashley Speliotis. Now, Natasha, tell us a little bit about yourself.
My name's Natasha. I'm a social worker here. I've been for about 5 years, and I do a lot of work with health insurance, housing, and other sorts of things, and groups
Hoarding?
Hoarding as well.
Gotta get that hoarding in
I
there.
know.
Ashley, tell us a little bit about yourself.
My name's Ashley Speliotis. I've been a social worker here for about 2 years in a medical facility prior to that, and Natasha and I work together quite a bit and to meet community needs and do a lot of supportive group and educational sessions at the Council on Aging.
So we're going to talk a little bit about open enrollment, but first I want to talk a little bit about Medicare and Medicaid. So why don't you tell us the difference between Medicare and Medicaid?
Sure,
Ashley?
absolutely. Medicare is our federally funded program. It's the program where when people commonly think that they're turning 65, they'll be signing up for. There is a little bit of leeway depending on when people retire, but most do become eligible at age 65. Mass Health, or Medicaid in Massachusetts, it's called Mass Health. It's our program for people who don't have health insurance through their employer when they're under 65. There is some services for people who are living in a nursing home, and there's a supplemental Mass Health plan for senior citizens. So we help meet with everyone and see what people will qualify through each different program.
And the Medicaid and Medicare really confuses people a lot.
Yes.
When we go in and we'll say, you know, I'm on Mass Health, how do I get on Medicaid? Well, it's pretty much the same thing. It is
Absolutely.
the same thing. And then, should I be on Medicaid? I'm on Medicare.
Yes.
Or they'll assume they're on Medicaid when they're really on Medicare. So how do you know the two difference? What should they be looking for?
I think that it's important when people turn 65. Some people are on Mass Health or Medicaid prior to turning 65. It's important for everyone to remember that they should apply for Medicare, and that becomes your primary insurance. Mass Health or Medicaid, you qualify through your medical needs and also through your income. So it's very individual, and that's why Natasha and I are Shine counselors and can help meet with people to see who would qualify for which service.
Now, there's a lot of things that we do besides helping with open enrollment, which is big in itself.
Right.
What are some of the things that you can help with Part D, or want to explain what the parts are? Let's do that first.
Yes. Part A is for hospital. When you get admitted into the hospital, you'll use your Part A to get admitted. Part B is for seeing your doctor, maybe your heart specialist, cardiologist, primary care doctor. You use Part B. Part D is for drugs. Easy, with Part D, it's drugs, and that helps with medications, filling in medications and things like that. And supplemental plans are either all-in-one, A, B, and D equals Part C. That makes no sense, but that's the way it is. Or the Medigap plan, which covers that 20% that Medicare doesn't cover for all Medicare-approved charges.
And the Part A, I think we said it already, but let's reiterate that it's that Part A is free for everybody at 65.
Right.
Yes,
that's
so everybody should apply for that when they turn 65, and then the rest of it, if they're still working and have a legitimate insurance plan, they don't have to jump on the Part B, but can grab the Part D.
Yes.
Okay. So it really is confusing, and that's why we do ask you to come in, sit down, spend a little time with you, and see what you're eligible. So open enrollment, when is it?
October 15th through December 7th.
Those infamous days, the Pearl Harbor Day is the end of it. Now, what happens if somebody misses that open enrollment?
Well, it's a too bad, too sad situation. You have to wait a whole other year to change your insurance, unless there's a special event, such as you move out of state, you have a qualifying event happens, but those dates, October 15th through December 7th, are the important ones. You cannot miss it. If you call me like December 8th and say, I want to make a plan, I can't help you.
And that's why we're here talking to everybody.
That's right.
You'll see a big push in the news and in our newsletter, and every place you go we'll be talking about open enrollment period, because we don't want you to go a whole year without it.
Absolutely.
What's the most important thing that somebody can come when they come to visit you? What is it they should
Sure.
bring when they come to talk about open enrollment?
Well, I think it's important to remember during open enrollment that if you have original Medicare, which is the Medicare Part A for when you're admitted into the hospital, when you have Medicare Part B, the outpatient needs coverage, those things are stable insurances. They can't be changed every year, but what can be changed is your Part D plan. So each Part D plan has a formulary set up by the insurance company. That's a fancy word for a list of medications and how they're covered. So for some people, you could start the year and like your cholesterol medication could be a tier 1 drug. That means it's the lowest copay. But next year it could be on the tier 2. And it could be a higher copay for you. What Natasha and I can do is we can run your medications through a certain computer system and see which insurance plan, which Part D would be lower cost for you, or a way for you to save money for next year and better meet your needs.
So it sounds like it's very confusing.
Mm-hmm.
It
So
is.
how does somebody pick what they want to do?
It depends what you want. People often ask, what's the best plan? And I have to say, there is no best plan. It's based on your needs. Who are your doctors? Do you love your cardiologist? Are you married to your PCP? If that's the case, we want to pick a plan that makes sure you can able to see those doctors and not to switch.
I always tell my clients when they used to see me was, who was the doctor you can't live without?
Exactly.
Could be a cardiologist,
Mhm.
it could be an ortho doctor.
Mhm.
It may not be that PCP, but
Right.
it may be
Right.
somebody who you
Mhm.
want to center all of your care around. Is that still important?
Yes, it is.
And what is it that we can do to fix that?
We can make sure those people who are the most important providers are kept on the plan. It's like I say, you can get the best plan, but if you can't use it with your favorite cardiologist, it's not worth a whole lot if you're paying out of pocket to see that one cardiologist.
That's right. There's other plans that sometimes for your monthly premiums are very low, but when you go to utilize services, you have higher copays, and it's very individual. It's trying to see how much you're utilizing healthcare and how much you are able to pay when you actually go to the doctor's office. So it's an individual conversation that we're more than welcome to have and to meet for as long as it takes to go through each step.
And the one thing I know we hear a lot is how expensive it is.
That's
Yes,
right.
yes.
And how do we help clients figure that out?
There are many programs in MassHealth that help save clients money, and a lot of people don't know about that. And we can meet with you to see which program you may be able to apply for. We have programs that will pay for Part B. It's $134 for a lot of people. That's money in your pocket. There's the Prescription Advantage that helps with that donut hole when you aren't being covered by insurance. That's money in your pocket. So when you see us, you save money.
Yeah.
So what happens if I'm prescribed a drug and it's not covered? What do we do then?
Well, if it's open enrollment, you can find a new plan and see which plans would cover it. Or if you want to change your pharmacy, let's say if ABC pharmacy won't cover it, if a ZYX will cover it, just change it to pharmacies and things like that. But there's a lot of solutions to this problem. We have the Mass College of Pharmacy has a helpline. Sometimes you're able to get a trial of medications for that time that you're not covered. Or if the doctor says, oh, I can prescribe a generic medication that is covered, work on that. So there's a lot of solutions.
Yeah.
And what about asking the doctor about generic? A lot of times we just go in and get the prescription. Is it
That's
okay
right.
to talk to the doctor about that?
Of course. You never want to change medication on your own or ask, but you can certainly have a conversation with the doctor and see if there is a lower cost alternative, or sometimes they have some coupons in the office or at the pharmacy.
And a lot of times people say, well, I have to pay for Part B. Is it really optional?
No, you have.
It is optional, but
Yes.
It's not a good option.
tell us
right.
why it's not a good option.
Let's say I decide to go without Part B for a full year. I say, no, not this year. And next year I think, yeah, I need Part B. Every month you don't have Part B is a percentage of penalty that you have for life. That penalty does not go away. If you wait 2 years, it's a 20% penalty. It's 10% per year. So if they wait 10 years, 100% penalty. I'm paying double the amount. So right now it's $134. Becomes $268 per month, per year, forever. So
Wow.
Right.
That's a big hit.
yes, it is.
Yeah.
And so if somebody doesn't pick up Part B because they say, oh, I'll never go to the doctors,
Yeah.
and they don't pick it up for 5 years and then they want to go pick it up, it's going to cost them 5 times that amount of $134?
It would be about 50% more for them, and there's very limited options for most people. For some, there are options without the Part B, but for most, your option for health insurance is to have Part B included in your plan. So it's really important. The other important thing to remember is that when you turn 65, you are going to get a lot of mailings, and in the mailing is going to be from Social Security to say, do you want to sign up for Part B, or reminder, sign up for Part B. A lot of people now are continuing to work and have employer-sponsored health insurance, but when you retire at age 67 or 69 or 70, the government cannot see that you've retired, so they're not sending you anything in the mail to remind you at that time. Sometimes your employer is not either, so it's really important to take that initiative and say, I'm retiring. Part B is part of my retirement plan.
We're going to take a break right now, and we're going to show you a calendar of events. We have so many great things happening, and we're talking about Christmas, so we'll be right back. Well, there's so many great things happening. You'll have to come to some of our special events that we're happening. We're doing everything all over the city. We're doing so much trips and activities and painting and dancing, and I don't know whether we're coming or going. I think for the next 2 months, I think there's 2 days on our calendar that we don't have anything at all. We'll have to check into that. So we're talking about Part B, Part A, Part D. It all equals Part C, which it really is confusing. So we have a hard time understanding it. How do we get them to understand? So we were talking about how important it is to have Part B.
Yes.
And what about Part D? Is that an option?
It is optional, but I always say you should really consider taking it. Like Part B, if let's say you don't take any drugs, and quite a few of my clients will say, I've retired, I'm taking any drugs, I'm not going to get Part D. And I'll say, let's say 10 years from now, your doctor says, oh, you need to take a new medication. You think, oh, I should sign up for Part D. You're going to be hit by a penalty for life. Like Part B, that penalty stays with you for a long time. I think it's a percentage per month you don't have Part D. So it's 12% per year that you don't have it. So that can add up quickly with a premium. If it's a $20 premium and you said you don't have it for a few years, that can escalate quickly.
Certainly can.
Yes.
Yes.
So Part A, no brainer, everybody should take Part
Free,
A.
yes.
Free, get it as soon as you can. Part B,
Yeah.
don't hesitate. It may seem like a little bit of money now, or a lot of money now, but in the long run,
Right.
it really is going to make a difference
Yes.
of how much you're paying on that premium.
Right. As soon as you start talking to your employer about retirement, start talking to us about how you can sign up for Part B and when you should sign up, because it will be right about the same time.
And if you're just turning 65, you have 3 months before
Yes.
the month of your anniversary, or your birthday rather, and 3 months after.
Yes.
So you really have a 7-month span for
Exactly.
able to figure out what you want to
Yes.
do. And in 7 months, I bet we could find one day for them to come in and chat with you.
Exactly.
Yes.
Important, that's great. We are going to take a break, and we talked about all those great activities. You're going to see a paint party that we did down at Ralph and Jenny. It's such a great event, we want to share it with you.
Hi, my name is Judy Calvey, and I am the Center Director at Ralph and Jenny at 9 New Washington Street, Somerville, Massachusetts. And today we have a paint day. And we have 15 guests that have come to paint and enjoy themselves and have a good time.
My name is Raquel Kaplan, and I am here in Somerville today to work with 15 seniors on a fall acrylic painting of waterfalls and fall trees. We have a sold-out class today. Each month, depending on the season or any holidays, I always do something similar. You know, in spring we had some dandelions. We've done all kinds of things. I try to use something different in each of my paintings, whether it be a black canvas like this month, or chalk was last month. Some Q-tips was used in our painting in May. We try to mix it up a little bit so nobody gets bored and keeps learning new skills when it comes to painting. I found that painting is a great de-stressor, great therapy, and so far everybody really enjoys it, whether they're nervous or not at first. By the outcome, they're all happy. I just think that this is a great program for anybody of any type of level. We start with beginner paintings to see the skill set, and we build up from there. So this is a teaching process as well as a nice social outing for everybody. So I think that it's a very well-rounded program.
If you'd like to come to Ralph and Jenny's or any one of the other senior centers, you call 617-625-6600, extension 2300. And Connie or Josie will answer the call and send you in the right direction.
So we've talked about Part A, Part B, Part D,
Yes.
which is all confusing.
Yes.
And my words of wisdom is come see Ashley and Natasha.
Yes.
That's right, because there's more.
There's
There's
more.
the
There's
supplement
more.
plans and
How-
Part C.
How come there? Oh, Part C. I was
That's
just gonna
right.
ask you, what about Part C? What is Part C?
Well, Part C is actually, it is insurance coverage, but when people think of Medicare, most often they think of Part A, Part B, Part D, and a supplemental plan as how people get their Medicare coverage. For some, a good option is what's called Part C, or a Advantage plan. These are plans where the insurance company is managing your health insurance, and they are, once you sign on to them, they're giving you the supplemental plan, they're giving you a drug plan, and in return they're managing your care. So you're going to see their providers, going to their approved rehabs, their approved hospitals. So it's like we were talking about before, what's important to you, what's going to make or break it. Is it your doctor? Is it the hospital? Is it a specialist? Those are things to consider when you think of Part C versus original Medicare. Original Medicare being the Part A, Part B, Part D, and supplemental plan all in your pocket.
And what do we call that plan in this area?
There's many, many different plans. There are some that are through Tufts, some through Blue Cross, Fallon, AARP, and all together they're called Medicare Advantage plans.
Advantage plans. And these are the plans where sometimes they can help you take your care a little bit further. You know, for instance, if you needed you have respiratory issues and you can't breathe, are they able to supplement you with sometimes an air conditioner or?
Sometimes what they can do is sometimes they have a little bit of vision or dental coverage, like for example the Tufts or Blue Cross or AARP plans. There's plans within the plans. So that's where you decide how much of a premium are you able to afford, how much of a premium do you need to pay for what benefits. And it's very individualized, and there are differences in medical equipment that's covered and different rehab needs, and that's where we would start meeting with you individually to talk about what are your needs now and what are your needs in the future, because if you're on an Advantage plan, you can change during open enrollment back to original Medicare. If you're on original Medicare, you can enroll in an Advantage plan, and like Natasha said before, even if it's not open enrollment, there is some wiggle room in certain situations.
Wow, this is a lot to take in.
It is.
Certainly is. But one last topic that I want to talk about, and again, it's going back to that Mass Health.
Yes.
So if somebody's been on Mass Health and, for instance, they've been in a wheelchair or they've been disabled somehow, they turn 65, what happens to Mass Health?
It becomes a secondary insurance. People think that Mass Health will stay with you as a primary insurance forever, and that's not the case. It's important to meet with us to sign up for Part A, Part B, and Part D, because Mass Health won't cover certain things, and your coverage will change. Also, the income limits change when you turn 65. Everything changes when you turn 65.
That's right. Some people think that because they're on Mass Health under 65, it will automatically roll over. But because of the different income guidelines, for some people it will go, you will think you'll have the Mass Health coverage for a few months and then it will suddenly stop. Even if you have Mass Health and it automatically rolls over, you still have to make sure you're enrolled in Part B or you won't have complete coverage. So Mass Health under 65 is not the safety net that you need past 65. You need to come in and review your insurance or to call Mass Health and read all the information that comes in the mail to see what part of Mass Health will be ending or what you need to do to continue to stay enrolled.
And sometimes you may have to reapply.
Absolutely. For a great number of people, that's the case, is that people come into our office on Mass Health and they have to enroll in Part A and B, and then we reapply for Mass Health for them to have that supplemental insurance. And the supplemental insurance through Mass Health or a private carrier is what covers the rest that Medicare does not cover. So right now, if let's say we turn or enroll in Medicare and get Part A and Part B and our Part D plan, we're still missing a chunk of coverage. We still are only covered at 80%, and we need to either enroll in a supplemental plan, which would cover that 20%, or for some people who qualify income-wise, they'll go on Mass Health that will cover just that 20%.
The other big key that we hear a lot of is nursing home.
Yes.
Who pays for nursing homes?
Medicare does not pay for nursing homes.
Right.
Medicare does not pay for
No.
nursing homes.
That's the shocking thing to hear. Medicare won't pay for that.
Yeah.
And there is a program called Medicare Dollars Follow the Patient. So there are supplement programs that they can stay home longer. And our job in the community is to help somebody stay there as long as possible. However, there may be cases where somebody needs to go to a nursing home.
That's right.
And then what do they do, Ashley?
Well, what happens is it's a very unclear answer when people say, are nursing homes covered? When you're in a nursing home, your nursing care and your prescriptions and the therapies are covered by Medicare or private insurance, but that room and board fee are not covered. So there is a large chunk that the family or patient's responsible for. In certain cases, they can apply for a Mass Health long-term care insurance, which would cover it. Other times, there's long-term care insurance in general. For some people, they end up paying privately for that portion until they spend down and are able to get on Mass Health.
So this has been a real big lesson about just pick up the phone and call you.
Yeah, absolutely.
A lot of great information.
That's right. It's also individual that you can't just ask your neighbor for their advice.
Exactly.
You have to just talk about you and your needs.
That's right.
Mhm.
So don't ask who has what in your friends.
That's right.
At the Council on Aging table, I walked in the other day like, oh, so what do you have? What do you have? I think I'll get that too. That's not how it works. You know, that's why I felt it was important for us to really talk about this. If you could leave the listeners with one thing, Natasha, what would you tell them?
If you come see us, it's free and we'll save you money.
Yes.
That's the other thing. There are agencies out there that will charge you up to $500 to do the same things that we do for free.
That's
Exactly.
Right.
And Ashley, what would be the last thing that you'd want to share?
Well, I think I just said it, that it's also individual, so don't be bashful. Come and talk to us. Bring your list of medications, and we'll see what we can do.
Is there anything else that they should bring? That's a good point. When you come to see you, you should always bring your list of medication because that helps you find your Part D.
That's right.
And if you don't have any, that's okay too, because sometimes it is important to pay that little bit of money to get that little plan.
Absolutely.
Because you may need something down the road.
Exactly.
An antibiotic, which I need. But there are so many different things that you could end up needing, and you never know when you're going to need that. Well, thank you both very much.
Thank you.
Ashley, Natasha, it's always great to have you on the show. You have so much information.
Thank you.
We appreciate it, and open enrollment is
October 15th through December 7th.
Don't miss those days. Those are the most important days. Mark your calendar right now because you don't want to miss a visit with Ashley and Natasha. And until next month, come and join us at all the great events that we have going on. We'll look forward to seeing you next month. Have a great day.
Thank you.